Professionals with access to vital information should have a civil duty to take the correct action in order to protect humanity as well as their employers. In 2014, an idea was proposed by Michigan state officials to supply Eastern Michigan with water from Lake Huron. They hoped this new pipeline would create better economic opportunity for the state and would allow more regional cooperation within Michigan. To save money, instead of continuing to pay for Detroit's water, Flint would temporarily use water from the Flint River. The city of Flint had no say in the decision as Michigan government officials made all the calls. The plan was for the water to pass through a water treatment facility, but this particular facility had not been used in a decade. The pipelines had unknowingly been corroding over the years, and the river water would be tainted with lead that leached from the pipes as it passed through. As the water was being delivered to homes, it passed through corroded old pipes, causing the water to look rusty and brown. The water had also been contaminated with Legionnaire's disease, a type of pneumonia. Legionnaire's is caused by inhaling water droplets filled with bacteria. The tap water could no longer be used, and the people of Flint began getting sick. The water treatment plant was turned back on without ever testing the pipes that ran to the communities. In the early 2015, the head of health department, Nick Lyon, was notified when residents began complaining about their water. Former consultant to McLaren Hospital in Flint and director of Special Pathogens Laboratory, Dr. Janet Stout, recommended that Lyon notified the Center for Disease Control and Prevention and requested help with the slowly growing outbreak. Lyon declined the help and kept his knowledge under wraps. The governor of Michigan, Rick Snyder, said that he was unaware of the issue until 2016, but emails proved that he and his cabinet had known since early 2015. By this time, there are at least 90 confirmed Legionnaire's cases since the switch in water sources. A study from the local Hurley Medical Center released data September 2015, which found that 2.1% of children aged 5 and under had elevated blood levels prior to the switch to Flint River, compared to 4% after the switch. According to Michigan government officials, there had been 12 deaths in the year and a half since the switch. By late 2015, the level of lead in the tap water had begun to rise. I created a series of maps that will help the audience understand Flint, Michigan's water crisis that occurred between 2014 and 2019. The first map indicates the known addresses of locations where contaminated water was observed. Flint city boundaries are highlighted in purple. By searching through ArcGIS online, I was able to find data already recorded. I plotted the data, which are represented as red dots, and added 2 shapefiles onto the map. One shapefile represents the water above ground, and the other represents water underground. Both were also found on ArcGIS online. In this first map, we can see the dispersal of the red dots as they spread from the Flint River and towards the rest of the city. The second map shows the regions within Flint and portrays the average price of homes throughout Flint. The data used for this map was retrieved from the US Census site, as well as a combination of price matching between Redfin and Realtor.com. The wider areas represent low value homes below $50,000, while darker green areas lean closer to $80,000 to $100,000, with the most expensive homes in Flint costing no more than $150,000. The southwestern areas of Flint is the airport, hence why it's represented as pure white on the map, this area here. It becomes easy to recognize that homes positioned closer to the water treatment facility are going to cost significantly less than further away, as we see here. The third map was created using proportional symbols. Each green circle represents the amount of lead in parts per billion found in each address. The data was also found on ArcGIS Online and is layered on top of the previous map. The larger green circles indicate the areas of Flint with the most severe lead poisoning. If we relate this map to the map of average home prices, we can see that areas with less poverty and that are more condensed are the ones that are more at risk. This could be due to the fact that the water treatment facility wasn't the underlying problem. It was the old corroded pipes that distributed the water. As we can see on the map, the hottest dispersal is here, which isn't next to the treatment facility plant, which means the pipes are the leading cause of distribution. The last map is closely related to the previous, as it resembles very similar data, just portrayed in a different manner of reading. This map shows the density of the dispersal of lead rather than specific locations. This makes it easier for the reader to understand that although not all addresses of contaminated water had been recorded, there are still many locations being affected by lead throughout Flint. The treatment facility isn't the main cause for the lead, rather than the pipes that had been rusting and bleeding into the water supply. This map helps us understand that the entire city of Flint was being affected by the lead pipes and the lead poisoning in the water. This map shows where it was more intense, but this map shows that it covered the entire city. So everybody in Flint was basically affected. In 2016, Todd Flood, a former prosecutor for Wayne County, was set to lead the investigation to determine what laws had been broken. Flood was able to charge 9 state and local officials with crimes related to the Legionnaires' outbreak. Many were charged with misconduct, conspiracy, neglect of duty, tampering with evidence, and even obstruction of justice for interfering with the investigation Wayne University was conducting on tap water in Flint. Although Michigan officials were only declared 12 deaths due to Legionnaire's disease, an estimate of over 115 pneumonia-related deaths had been investigated and were suspected to be caused by the switch in water source. Lyon is now facing involuntary manslaughter charges for neglect to inform the correct authorities and endangering the public. In a 2018 statement, Lyon shifted the blame away from himself and directed it towards McLaren Hospital, stating that they were the reason for the outbreak. McLaren Hospital said that they get their water from the same pipelines as the rest of Flint and had their water tested. The results concluded that the water had low chlorine levels and high concentrations of iron, which allowed biological growth inside the already corroding pipes. Efforts have been made to reverse a fraction of the damage that was done to Flint and neighboring communities that were impacted by lead poisoning. A project has been underway to replace the pipes in Flint. So far, the project has checked the water pipes at more than 26,000 residents and replaced more than 9,500 lead and or galvanized steel pipes. It is believed that Flint has only 500 service lines left to be checked. On April 7th of 2021, Deborah E. Greenspan, U.S. District Court Special Master, told Judge Judith E. Levy that more than 50,000 residents in Michigan had signed up for the Flint water crisis settlement. The total cost for the settlement was submitted to the court for an amount of $641 million. All the lives lost and emotional damage of the families of Flint is irreparable and could have been avoided. If the head of health department had acted and notified the right authorities, then it's possible that hundreds of lives could have been saved from the dangers of lead. The money saved by cutting corners does not weigh up to the money spent on repairing the damage caused. As professionals, we need to take proper action when handling such vital information. The GIS Code of Conduct and Rules, the GIS Code of Ethic and Rules of Conduct has taught us that it is our civil duty to protect the public with any intel that could damage lives and or the environment. The Flint water crisis was a prime example of negative outcomes that occur when corners are cut, information is kept, and government officials abuse their power.